He had a canceled flight and had to leave early to go home on an earlier flight. So I am pinch hitting for him. So welcome back. And we are now going to switch our focus from east to west. I'm guessing we're not going to hear about hurricanes in this session. And I have three speakers that have been able to join us this afternoon. First, Kathy Gerwig, who is Vice President for Employee Safety, Health and Wellness and Environmental Stewardship Officer at Kaiser Permanente. Then we have Renata Brillinger, who is Executive Director of the California Climate and Agriculture Network. And last but not least, Fletcher Wilkinson, the Climate Change Program Coordinator at the Institute for Tribal Environmental Professionals at Northern Arizona University. They're each going to take about 10 to 15 minutes to give some opening comments. We'll then have questions and discussion. So without further ado, Kathy.
Great, thank you so much. It's been wonderful traveling around the country with all of you today, and we'll be telling you the story about being in the West. And I'm going to give a perspective from Kaiser Permanente, which is a very large integrated health system with hospitals and Permanente medical groups and an insurance plan. And our climate action is a key pillar in our environmental stewardship efforts, which is a component of our community benefit work. And for some grounding, here are our 8 regions. Most of them are in the West, and as you can gather there, of the 11.7 million health plan members that we serve, about 10 million of them are in those Western states. And an even greater percentage of our greenhouse gas emissions is in the western part of our organization, because that's where all of our hospitals are. In the eastern regions, we have medical facilities, but not hospitals. And most of our 70 million square feet of real estate is in the western states. A large portion of that is in California. And that's important. I also put on the same chart some political context, because we're a little bit different when you look at Kaiser Permanente communities and where we're doing business. We're a little bit different from national trends. And as you can see on the chart there, in the 115th Congress, the House has clearly got a GOP majority, but in Kaiser Permanente states, Democrats outnumber Republicans 2-1. And when you look at the Senate, there is a majority in the Senate, of course, of Republicans, but the Democrats outnumber Republicans in our states by about 4-1. And it doesn't just reflect on the national government. It also is important for us as we look at state government, and all of our western states have Democratic governors. So it's just important as we think about the political context and what some of the opportunities are for the work ahead of us, that we take all that into account. I wanted to take a moment to say that healthcare organizations wear a lot of different hats. Of course, they wear the clinical care hat, but they appear in all sorts of other forums. And so I wanted to take a moment to just talk about what those places are where we show up. First of all, as you heard from speakers earlier, healthcare, in particular hospitals, are big emitters of greenhouse gas emissions. So we are culpable in the carbon footprint in the country. We're also big water users, big waste generators, big environmental footprint. We also have a lot of jobs. Hospitals are often the biggest employer in their area. At Kaiser Permanente, we are the largest private employer in the state of California. We also have a lot of retirees that live in our communities, and they are a powerful force that we love to take to bring into the community work. We're huge purchasers. Every hospital buys a lot of stuff, and we are no exception. We also have big supply chains, and that supply chain can be global, but it can also be quite local, and there are implications for climate change on that. Big landowners, I mentioned we have 70 million square feet of real estate. We also are a large grant maker, as are most not-for-profit systems, and we're big investors. We have foundation funds to invest, and how we do that, the degree to which social investing and climate criteria are included in that is important. So in addition to all those hats, I wanted to mention an important opportunity, which is the Community Health Needs Assessment. And this Community Health Needs Assessment is a requirement of every not-for-profit hospital to do every 3 years, and it's tied to the Affordable Care Act. Who knows what will happen, but early signals, at least in the repeal and replace discussions, have not targeted these CHNAs to be removed. Time will tell, but at this point it looks like they continue to be an opportunity because they increase accountability and transparency for how not-for-profit hospitals spend their resources. And it is in that opportunity that I wanted to spend the next couple of slides and talk more about this Community Health Needs Assessment. Keep in mind, it's not a community health care needs assessment. It's not just about access. It's about working with communities to identify health needs and then using the hospital as a place to have a conversation about how to meet those needs. So it's quite broad. And by the way, a resource for this is a website that's chna.org, communityhealthneedsassessment.org. So for the very first time, climate and health is showing up as a community health need. You can see it in red on this chart. It's not particularly high up on the chart, but in our case, what you're looking at is the Kaiser Permanente hospitals. So we have 39 hospitals, and of those, 14 had climate and health show up as part of this exercise to identify needs that the community has identified as health needs. And, but I think the most important thing about this chart is to look at the other areas that are shown in green, because those are where we see co-benefits. And many speakers have talked about this today, but this is a tool where we can drive what hospitals do and how communities engage in addressing the climate co-benefits. And many people have already talked about it, but let's take a couple of these as examples. So let's look at obesity, which is at the top. At most of our facilities, you know, obesity is number 1, 2, or 3 on the list of community health needs. And so what are the things that we could say we're going to promote as we're addressing obesity with climate co-benefits? Well, additional physical exercise, so creating walkable communities, bike sharing programs, bicycle paths, active transportation, more transit, community gardens, less meat consumption. Those are things that address obesity and also address climate. I mentioned a moment ago that we're big purchasers. Hospitals are big purchasers of stuff. And when you look at economic security as being a community health need that's prominently identified, what if we could move a lot of sourcing to be more local, more diverse and more local? That has climate benefits. Local jobs mean shorter commutes. You get lots of benefits from that. And maybe just picking one more, asthma is a prominent need that you see, and less particulate matter from less car trips also means less fossil fuel use and less greenhouse gas emissions. So this is a tool that is occurring now in communities that are responding to this requirement. And I wanted to take just a community dive into this specifically. And the way to read this chart is if you look at where there's a little dashboard and a red needle, the red needle shows the community indicator of the community that we're looking at. And the top half of this slide relates to Kern County, which is in the Central Valley in California. So the red needle is the community indicator. The orange, yellowish bar is the California benchmark, and where there's a blue bar, that's the national benchmark. And what you can see when you look at Kern County, the upper half of this chart, you see that asthma, obesity, and the days exceeding standards is egregious. The quote that you see there is by a community member as part of this community health needs assessment approach. If you suffer from asthma, then you may not go outside and be active, and then you're gaining weight and you're not eating healthy food. If you look at the bottom left, it shows that youth physical inactivity is high. This is in Moreno Valley, which is in Southern California. And the quote there around youth inactivity, physical education programs have been scaled back in public schools, and outdoor sports and exercise programs can be challenging because of the hot climate. And one more, if you look at the bottom right, it's about road density. And you can see that it is the lack of local jobs that are causing very long commutes. Those have all sorts of implications for the environment, but is another place where if we could have more local jobs, shorter commutes, you improve economic security and you get climate co-benefits. So with all that, I wanted to take a couple of minutes and just talk about what we're doing at Kaiser Permanente. And I always start with the transparency of what it is we're emitting. So what you're looking at are the greenhouse gas emissions for our entire organization. And we're at almost 800,000 metric tons of CO2. That's as of 2015. The vast majority of that, more than 90% of that, is from running our buildings. It's to power and heat the buildings and equipment. It's important to note that our greenhouse gas emissions in 2015, where this chart is, were down 5% from 2008. And that was despite a 20% growth in our membership. So we built more hospitals, we had 20% increase in membership, and yet our greenhouse gas emissions decreased by 5% because it's an absolute target that we have. Having much of our operations in California, as you saw before, means that we're drawing from a grid that is getting cleaner. And that's important because about 25% of the power in California, the electricity, is from renewable power. And so that's an advantage to us. There are also other opportunities in terms of power purchase agreements and arrangements that we can take advantage of there, in part because of the political climate that allow us to green our own energy. And I'll show you just more details on that in just a moment, but I wanted to frame our energy policy around this list, which these are 2025 environmental goals for the organization. And at the very top, you see that climate action is our #1 goal. And the goal is by 2025 to be net carbon positive. That means to be a little bit better than carbon neutral by 2025. And there are several other goals here. I'm sharing the whole list because many of them are related to climate, as many of you have spoken about earlier today. We have a goal that by 2025, 100% of the food we buy will be sustainably or locally grown, and that clearly has climate benefits. And we also have a goal to have zero waste by 2025, and that has climate co-benefits, as well as water conservation. So specifically what we're doing on renewable energy, and remember it's 800,000 tons of CO2 that we're emitting now, so how are we going to get rid of all that by 2025? Well, we're actually well on our way. The emissions chart that you saw was from 2015. In 2016, we went live with 2 major off-site energy projects. One is solar and one is wind. In California, those are online now and are drastically reducing our greenhouse gas emissions. And in addition, at over 100 of our facilities, we're installing on-site solar, and that is also well underway. So as of right now, half of the electricity that we use to power our California facilities is renewable, solar or wind. Additionally, we also require all of our new construction, major construction, hospitals and medical offices and other types of buildings, we require them to meet LEED Gold certification. And that's another way that we can, from the very beginning of design, build in these kinds of programs that are supportive of climate action. So I wanted to add my thoughts on what the voice is for healthcare on climate change and reflecting why healthcare institutions are so important to addressing the community well-being as it relates to climate. As we have heard today from very eloquent speakers, that communities are already suffering, and we're seeing that as a healthcare organization. And also today, there has been a beautiful conversation about equity, and we appreciate that those who are suffering most are those least able to be resilient against the onslaught of climate change. And then finally, because we are big emitters in healthcare, we have an obligation. So just to close out, the summary is that using community health needs assessments is an important opportunity that is a tool for communities to engage around and to engage not just with their healthcare partners, but with anybody who cares about health needs, and looking at that as a tool to address all the issues around vulnerability of communities. I think promoting renewable energy and energy efficiency, while I know that having a lot of our operations in California gives me a bit of a bubble perspective, there are lots of opportunities in lots of parts of the country. And asking your healthcare partners to publicly report their greenhouse gas emissions, to require LEED certification, and to ask suppliers to use local employees is something that will have many climate co-benefits. So with that, thank you very much.